We're talking now with Paul KORNBLITH, the class of 1958, College of Science and Technology. Thanks for joining us.
Thank you.
I want to give a little bit bio information. Paul began his career as an intern at Graduate Hospital, the University of Pennsylvania, and served in the Army Medical Corps in Korea and at Valley Forge Army Hospital, and then worked his way up to medical advisor at Pittsburgh Life Sciences Greenhouse. Let's talk about how you became interested in the field in the first place.
Well, it started really at Temple. I was, as an undergraduate, I was majoring in organic chemistry with Dean Caldwell, and was the dean and also the professor of organic chemistry. And I found that I really liked organic chemistry, and I decided that I would go to the dean and ask if I could do research. And the response was, no one's ever asked to do research. And he says, but I don't see why not. And he took out his wallet, gave me a $10 bill, said, this is your start, go get your starting compound and synthesize the first part of a drug for treating cancer.
Fantastic.
And this was in, say, 1955. And he said, you can use my laboratory, and which was one of these little buildings. Was the dean's office was on the first floor, and the second floor was the dean's laboratory, which was also a passageway for the chairman of the department to go to his office. And I had that laboratory used mostly to myself because he only had one graduate student, and he himself was not doing research anymore. But his research was all in chemotherapy drug synthesis, which becomes important in this story. And I worked there for about 3 summers, and also during the year, and did my own research. I didn't have much supervision, and I didn't work for anybody. I just learned myself. I actually was able to synthesize some material, small amount, because $10 worth of starting product was not very much. And I won some sort of award from the American Institute of Chemists, and I was considered the best research for an undergraduate in Philadelphia.
That's fantastic.
So it was very nice, and I learned how to do research on my own and how much I enjoyed it. And it was in an area that I was interested in. I wanted to be a physician, I wanted to be a surgeon, I wanted to be a scientist. I had all made up that decision when I was in high school. I went to Central in Philadelphia.
Okay, so a Philadelphia native.
They had a neurosurgeon who came as a visiting lecturer. They had an endowment, the Barnwell Endowment. They invited a lecturer, and he had trained with Harvey Cushing, who founded neurosurgery. And he had some wonderful stories, and he was the physician to the Empress of China, and it was a very romantic sort of vision of the world.
And very inspiring to
you,
obviously.
Inspiring. Turns out some of his research I later learned was controversial, but he was, he was research-oriented, innovative type guy, and a famous neurosurgeon.
What would you say has been, over the course of your career, the most rewarding part of it for you?
Well, I've had really 3 different careers. One that was as a clinical neurosurgeon, and parallel with that was this being a scientist, and third is my current career, which is entrepreneur. So I've done clinical research and entrepreneurship, and I enjoyed all of them. They're totally different, but they all mesh together.
In today's current climate, what's your biggest challenge with what you're currently pursuing?
Well, at the present time, it's a very difficult time because the NIH funding for basic research has been diminished, so that people are challenged to get research funding to get things started, and it's very hard to get money for startup companies. I've built a company that I started myself based on the research. This is the follow-up. The research that I did here was on chemotherapy drugs, and I built a company that was testing which drugs to use for which patients, individualized medicine. And it's raised a significant amount of money and been successful. Has 150 employees, and it's a nice successful company. But now I'm involved with about 12 other companies, so that I'm developing new companies. It's very difficult now to get the money because people are risk averse now. So
Sure.
it's not a generous giving time for high risk investments. So that's
Paul,
the current
let
issue.
me ask you, you showed enormous initiative as an undergraduate to achieve what you were able to do. For the current class coming out in 2013, what would your advice be to current Temple students?
Well, I think that if you have any interest in especially I'm representing science and technology, if you're interested in that area, the sooner you can get into something that's exciting and to get engaged in it, the more likely it is that you'll prosper and be happy in the field, and you'll be able to make it. Because it was very useful, because I was able to follow that work that I did at Temple. When I went to Jefferson for medical school, I did exactly the same thing. I went to the chairman, one of the senior professors. I said I want to do research. Nobody's ever done research with me, and I ended up developing a whole field of medical research and angiography and medical angiography based on that work. So you learn from what you're doing to then build something else. And if you get started in that, the earlier you get started with that sort of attitude, the better. So I think that's the message that I think is that's why I'm sort of here today, because the dean had spoken to me about the interest in developing undergraduate research and getting an early start.
Great.
And I think it's a very critical thing, because after a while you get into the grind of just more or less standardized lectures and teaching and so on, which is fine, but it's not as inspiring as when you have to actually do something yourself.
Terrific. Thank you so much.
You're welcome.
Congratulations again. We've been talking to Paul KORNBLITH, class of 1958 from the College of Science and Technology. Thanks again.
Welcome. Thank you very much.